I'm Emily Corville. I'm with Carson Animal Hospital and the For Blonde Doc podcast. I'm here today with another blonde doc.
Dr. Christy Frady.
Yeah, happy to have you here today.
Yes.
We're so excited. And today we're going to talk about heartworms. Yeah, you guys might be wondering what I have here. It is in fact a heart with
some worms.
You guessed it, worms in it. So we're going to talk about that a little bit. So, Frady, how often do you think you see heartworms?
Oh, all the time. Like pretty much any dog that's like not on prevention. If they don't have heartworms, you're very lucky.
Yeah.
In Louisiana.
I agree. I mean, we see it all the time because, they get it from mosquitoes, which I feel like a lot of people don't know that, which is interesting. But they get it from mosquitoes, and if you're in Louisiana, they're everywhere.
All year long.
Yeah.
Pretty much.
I mean, we have like a lot of standing water around and just, I don't know, it's very...
Yeah, I mean, even in your house, people think if they're indoor, they're like, well, can they still get, if you can get bit by, anywhere you can get bit by a mosquito. So, even in your house.
Yeah, that's true. They're everywhere. So, yeah, dogs can get, and cats, I guess, can get bitten by a mosquito and get heartworms, which is exactly what we talked about, worms that live in their heart.
So I guess we can talk about life cycle
and
like what they are.
Sure.
So they're transmitted by mosquitoes. So the mosquito picks up a lot, like it feeds on a dog that is heartworm positive, picks up larvae from their bloodstream, and then goes and bites a non-infected dog, injects some of the larvae into their skin, into their bloodstream. The larvae migrate. They eventually, over 6 months, mature into adult worms. And then your dog, if they're not on prevention, they'll test positive.
Yeah. And I feel like the 6 months thing is really good to mention because a lot of times, and I mean, we're all kind of guilty of this, maybe you skip a dose of your prevention, or let's say you even adopted your dog from a shelter and I don't know, or you found a dog and you bring him to the vet and you're like, we got to test for heartworms because it's so prevalent around here, and they test negative. And you're like...
6 months later, they're positive.
Exactly, yeah. So, I mean, I think that that's like an important thing to remember is that just because they test negative, the heartworm test we're running is testing for adults, So they could still have young adult juvenile heartworms circulating and not test positive.
They just haven't matured yet.
Yeah, exactly. So it's important that, if you skip your prevention or you get a dog from a shelter, you find a dog, that you always remember to come back in 6 months and test again.
Yeah, and people kind of also don't realize like how prevention works. Like prevention basically is killing any microfilaria or larva like in the dog's bloodstream every month. So it's kind of like back treating. Like if they got bit by a mosquito and they are heartworm, if they have larvae in their bloodstream, the prevention every month kills all those larvae so they can't mature into adult worms.
Right. So basically we're killing the babies that they're getting injected with.
Yes.
Yes. Okay. And then, or the babies that the adults, I guess, are producing within their body. Right?
Yeah, that too.
Yeah. But more just the ones that are injected with, I guess.
Yeah. And then if they have adult worms, then you have to go through like actual heartworm treatment, which is more intense.
Yeah, it is pretty intense. Should we talk about prevention before we talk about the treatment?
Yeah, we can talk about prevention.
Okay. So what's your favorite kind of prevention?
Something's better than nothing. Anything's better than nothing, but I like ProHeart because you can't forget. ProHeart, they make it in a 6-month shot, a 12-month shot. So that's what I do with my dogs. It's like January 1st, ProHeart 12. I never forget it because they're on. So it's a heartworm prevention that lasts a year.
Yeah.
It's nice.
I like it too. ProHeart's my favorite too. Just because like a shot you give once a year is just so convenient,
Easy.
And it has the active ingredient is moxidectin, which is the best thing for the circulating microfilaria babies, right?
Yeah.
Which is pretty cool.
Yeah. No,
yeah.
That's neat.
So it does a lot of things. So I would say ProHeart's really cool. Simparica Trio, I feel like is a new one.
Yeah, I love that one. Because it's really good for fleas too. Yeah. There's no shot for fleas, so if you're giving something for fleas every month, a lot of people like Simparica Trio. Yeah. So that one's really good too.
I think it's great, yeah, but it is a monthly tablet that you have to give. Yeah. Some dogs don't like that.
And some people are really big on like ivermectin or HeartGuard, it used to be a very good drug, but now that we're seeing like resistant heartworms, so it's not the best. It's better than nothing, but it's not the best. So if we hear of anybody like on HeartGuard, we usually try to
switch them over.
Yeah, switch them over.
Yeah, I agree. I think, and then Advantage Multi, Amoxi, those are really good too. That's anything with like a moxidectin in it is typically my favorite.
Yep.
Which you're talking Simparica Trio, ProHeart, Amoxi, those are really good products. But as you said, something is better than nothing, trifexics. So you got like your macrocyclic lactones or whatever. And you have HeartGuard, which is like ivermectin and stuff like that, which is
yeah, not the best.
we'll take
but
it,
better
but
than nothing.
it's exactly, yeah. So I mean, those are good things to have. But let's say you didn't know about prevention, or I don't know, you got a dog that tested positive for heartworms. Now what do we do, with a heartworm positive dog? Because we can imagine that if there are literal worms, I mean, imagine a heart with all those worms in it.
Spaghetti.
Yeah, woof. That's probably creating a lot of damage and causing a lot of problems, and the heart's not functioning the way it's supposed to. So we want to get them out of there as soon as possible,
Yeah.
So what would you say is like your treatment of choice, or the treatment of choice?
Treatment of choice is like it's called, like, there's like a fast kill method and then a slow kill method. Slow kill is just kind of like better than nothing.
Yeah.
Fast kill is like gold standard. So you started off with a month of doxycycline to weaken the adult worms and make them not as contagious anymore. If mosquitoes bite the dog, they can't transmit it anymore.
So doxycycline, this is how I always explain it to clients. I say, this is what I say. There are bacteria that live on the heartworms.
Then that's like a symbiotic relationship.
They love each other.
They love each other.
And whenever you put them on an antibiotic like doxycycline, it kills the bacteria. So although it doesn't,
weakens the worm.
Exactly. So even though it doesn't like hurt the worm, it does, because it's taken away their best friend or whatever.
Yeah.
So like that's how I look at it.
Makes sense.
Yeah. So we'll do the doxycycline to kind of destroy the worm, destroy the bacteria that live on the worm.
Weaken the worm.
Yep.
And then
keep them on prevention, or start them on prevention
the whole time,
because we don't want more babies coming in.
Right.
And then we wait a month.
And then we do a series of 3 injections. So the first injection, and then we wait a month, and then you do injection number 2, and then you wait 24 hours and you do injection number 3. And this whole time, it's important, while the adult worms are dying, because they're in the arteries around the heart, that the dog's like, you try and keep them calm, you don't get their heart rate up, because these worms are dying, you don't want them to like dislodge and go into a large clot into the lungs. So you have the dogs on steroids to prevent reactions the whole time. You try and keep them calm. And then 6 months after that, well, I think the recommendation is 9 months now, but we still usually test at 6 months and they're negative.
Yeah, it's awesome. Unless they have like some crazy resistant situation, which we hardly ever see. But I was going to say about the shot. So you said we give 3 injections. I think it's important to say that these injections, so they're melarsamine injections or adulticide injections, are different from a ProHeart injection.
Yes.
Because these are killing the adult heartworms. Is the only product that we have that will kill the adult heartworms.
Yeah.
And it is pretty intense, I would say.
Yeah.
It's not like it's a...
It's a painful injection, and they need to be rested, so it's like people are always worried, if you have a positive dog that's a hunting dog and they need to be very active, it's like, sorry, they have to skip a season, or
it's true, because like you said, like if any of those worms get dislodged, and basically they can have like a stroke, I mean, like an embolism, and that would be not good either.
So a lot of people are scared of heartworm treatment, but it's way better than the alternative. I mean, having heartworms and then going into heart failure.
I agree.
Yeah.
Yeah, and like, I mean, you said, we had mentioned the slow kill, which is better than nothing. But I think some studies have showed that dogs will remain heartworm positive for like 5+ years.
Yeah.
Or can. I mean, there's some dogs, like if you're lucky, they'll be negative in a year. But and when we say slow kill, like what does that mean? Basically, you put them on the antibiotic, you stay on prevention, and you just wait. It's a waiting game at that point. Game. Yeah, and I think like as long as the worms are in their heart, pulmonary hypertension, changes to the lungs that can be life-threatening.
The vessels,
The vessels, the heart. You said, congestive heart failure, things like that. You know what I mean?
Yep.
And then whenever it gets to the, I guess, latest stage of disease, they can have something called like Cavel syndrome.
Yeah.
Yeah, which is like basically it's getting lodged in their vena cava. I mean, it's like they can't...
It's like all the worms fall out of their pulmonary arteries and they fall into the heart and they're obstructing the valves in the heart. And so then you like acutely go into right-sided heart failure. I mean, it's very obvious the dog's sick. They're panting, they're like collapsing, they're not eating, they're not drinking, their belly usually fills up with fluid. And then that's like, I mean, a very poor, grave prognosis. The only thing you can try to do is like We've done it before here, but a very low success rate. But you just you cut into their jugular vein and literally go grab the heartworms with forceps or a long little catheter out of their heart and try to take them out of right-sided heart failure.
Yeah, that's crazy.
But most dogs died during the procedure or shortly after. We have one dog that did very well. His name's Pac-Man. He lived 4 more years after that procedure. But yeah, he did amazing. He was a big pit bull. He was really tough.
Oh my gosh, that's so cool. And you did it? You took the little worms
Yeah, it was awesome. Yeah.
That's so cool.
And it's cool because you can listen while you're doing the procedure. And they have a really loud heart murmur whenever the heartworms are stuck in their valves. And you got them all whenever the heart murmur just goes away.
That's so cool.
As you're pulling them out, somebody's listening and they're heart murmur's gone.
Oh
you're cool.
Gosh.
Yeah.
And it's so rewarding that he
it
lived
is.
for so much
I
longer.
know.
That's amazing.
Yeah.
Oh my god. Yeah, but we hope that they never get to that point.
Yeah, because that's Pac-Man's a special case. We've had I don't know, probably 15 cable syndromes, and Pac-Man is just one dog who survived that.
Yeah,
so.
out of all those dogs. And it's just...
And he still had right-sided heart issues going forward. Yeah.
Yeah, because it's once there are change, we can't undo.
Once the damage is done, it's done.
Yeah, we can't undo it, and so that sucks. So that's why I think the fast kill is so important, because the faster we can get those worms out of there,
less damage.
Less damage. Yeah.
And I think another interesting fact is most people are okay, if I don't do any treatment, if I just keep them on prevention, how long until these worms die? And we're you don't want to do that, because adult worms live 5 to 7 years, just that's it. And if you do slow kill, supposedly they'll die in 1 to 3 years. Like you said, some dogs get really lucky. My own personal dog, I tried to do slow kill. When I adopted him, he had heartworms, and I was going through vet school. I didn't have the money to do fast kill. And he was still positive after 3 years, and then I did fast kill.
Isn't that crazy?
I know. And some dogs are negative after 6 months, 1 year.
It's so true.
Yeah.
It just kind of depends on the dog and if they're going to be one of the lucky ones or not. Yeah, I mean, it's just a gamble. You don't know. But, you have a lot of experience considering that, you even did the slow kill, and you did both. You know what I mean? As an owner.
Yeah.
If you do the slow kill, do you feel like they still need to be rested?
Probably, technically, but I didn't.
Yeah.
Yeah.
It's hard.
I feel like that's one of the good things about slow kill is, I don't know. Or some people do that, this is not great. It's not gold standard, but if they, want them to hunt that season or something, they'll be I'm going to do slow kill until, when it's not hunting season, and then I can do fast kill.
That's true. Yeah. And then you just have to kind of crack down at that point.
Yeah.
That makes sense. It's pretty interesting. Yeah, but I mean, we hate heartworms, but at least we have things we can do about it. You know what I mean? Which is nice. So,
yeah.
I don't know.
And it's Louisiana, so it's
unavoidable pretty much.
Yeah, if you look at the map, Louisiana is the darkest red, the most concentrated
area.
For
the
heartworms.
Incident.
Yeah.
Yeah, exactly. No, it is. It's very concentrated right there. But I guess surrounding states too.
Yeah.
Anywhere that
Oh yeah, it's definitely, but it's when you look at the map, you're oh, we're right in the center. Most terrible area. Yeah.
Yeah, exactly. Do you think that heartworms are a seasonal thing, or
not really? It's kind of like fleas too. People will say that they'll be in the wintertime, okay, I don't give them heartworm prevention in December through February. And I'm yeah, maybe they're less likely to get bit by a mosquito, but we still see it all the time.
Yeah, I agree. I mean, you can't. Mosquitoes are around
all the time.
Always.
It's Louisiana. Yeah.
And I think you had said this earlier, and just to reiterate, if you have a fluffy dog, if you have a dog that's inside only, I've seen mosquitoes in my house.
Yeah.
You know what I mean? They can still, and even if you have a fluffy dog, what about the nose?
Right.
Bite them right there. Yeah, exactly. There are
belly.
areas that are hairless, or even through the hair, they can be bitten and stuff like that. So I think, it's a year-round disease for sure, and no dog, unfortunately, is exempt from heartworm disease.
Yeah.
They kind of are all, especially in this area, at risk.
Yeah, if they live in Louisiana, they need to be on heartworm prevention.
Yeah.
Even if they never go outside. They only use potty pads inside.
Yep.
Yes, they're less likely, but it's still possible.
Yep.
And you don't want your dog to get heartworms, so.
Those little toy poodles that never go outside.
Yeah,
they're the ones.
Yeah, you still need heartworm prevention.
Exactly. Awesome. All right. Well, I mean, I feel like we covered a lot of stuff.
I think so.
Yeah. I hope, someone learned something about heartworms, which is great. But I'm sure you guys will see us next time for our to be determined topic. And in the meantime, if you guys have any other questions or concerns about heartworms, please feel free to give us or your regular veterinarian a call.
Ask us any questions in the comments.
Yeah, exactly. Yeah, just let us know what we can do for you.
Make sure to like this video.
Yeah, like and subscribe.
Like and subscribe.